Hi everybody, Dr. Ron Hershey here at South Hill Wellness Center again on Tuesday, our Tuesday Facebook Live. And today we're going to be doing something different. I'm going to be explaining a new service actually that I'm going to be making available called functional medicine. And I know Dr. Powell has his little segments where he talks about fun with Botox. So I'm going to have fun with functional medicine with y'all. So it's kind of an up and coming movement actually in the healthcare community. I've been involved with it for many years. I have not really done a whole lot with it. Recently, particularly since I'm so busy with the chiropractic, fast-paced chiropractic part of what I do. And functional medicine is something is not fast-paced. It takes time. And one of the reasons why I'm thinking of doing this switch and introducing this now is because we changed our schedule around so that I'm freed up a lot of hours on Wednesday now. I'm not seeing chiropractic patients on Wednesdays, so I have more time. And it's been an interest for me, and I can go into, actually it started off many years ago with my wife having severe hot flashes early on in her 40s, and trying to learn what to do, because she was not really interested, and I was, not interested in having her do the usual hormone replacement therapy that was getting such a bad rep, and because using the non-bioidentical hormones were not working out for people very well. So that got me started, and one thing led to another. I just started learning more and more and more, and it was interesting to me to help people get back on track with a healthier lifestyle for one thing, because functional medicine does not really treat diseases. We're not really diagnosing and treating diseases. We're looking at the physiology of your body's function, how it's functioning. And I can give you a couple examples of what we do, because what we do is the first thing that we do is we have the patient fill out this, what we call, I don't know if you can see this, but you're not going to be able to see any detail, but it's a symptom survey. So there are actually over 200 symptoms listed here, and you can check off mild, moderate, or severe, and that gives me an idea of what's going on with you, what problems you might be having with energy or sleeping or digestion, and there are groups. It's grouped into different physiological functions and different organ functions. That gives me an idea of what's going on, along with we actually use traditional blood work and other types of labs that we use. Actually, traditional and non-traditional. Non-traditional would be, for example, saliva testing. Saliva testing, we are able to get some really good information on the adrenal functioning of your body. So, for example, a person is having problems with energy and fatigue. There are different things that we can look into. Adrenal function is one of them. And the other thing that I wanted to talk about and give you an idea of the difference in what we do as opposed to going to a traditional medical doctor is we look at the labs in a different way. So I have a sheet of a lab report, for example, with vitamin D. And one of the things that we look at, and there's pretty much all of the different aspects of the labs that are done, the ranges in functional medicine are narrowed down. I'll give you an example. So vitamin D. Vitamin D, when you look on your LabCorp report, and we have vitamin D drawn, checked, the range is 30 to 100. So typically, if you go into your medical doctor and you have the vitamin D test done, and let's say your test result comes back and says 45, and I say, great, your vitamin D is good, no problem. Well, from a functional medicine point of view, it isn't a major disease type problem, not causing any diseases, but it's not functioning as good as it should be. We're looking to see it at the 70, 80, 90 mark. So we're trying to get your body to function optimally, and it's not really looking to treat diseases. And all of the different labs that we look at, we look that way. All of the functional medicine laboratory ranges are narrower, and when we're trying to get them to function at the optimal level as close as we can, using not drugs, but vitamins, herbs, lifestyle changes, diet. So it's a more natural alternative approach to improving your health. I have an example of one woman, and we can talk about, who gave me permission to use her case as a documenting of how we work and what happens. She happens to have a really, really intense problem that she's been dealing with for many years. Since she's 30, I think she's 32, 37 years old now. And since she's been in her early 20s, and even before that, she was having lots of pain, fatigue, and she has that extra hyper flexibility in her joints. They're people who are what would you call
the double jointed?
Double jointed, yeah. People are called double jointed, right? And I didn't really know this, but she was diagnosed. Although this particular syndrome that she has is not really definitely diagnosed until they get a DNA test, because it's a genetic defect. It's called Ehlers-Danlos syndrome. You can look it up. It's kind of a weird spelling. Ehlers-Danlos, I believe. Ehlers-Danlos syndrome. And it has a wide array of different problems. And her major problem has been, for many, many years, since she's in her early 20s, fatigue, pain everywhere. She's been to chiropractors, she's had acupuncture, she's had all kinds of treatments, drug treatments for her pain and fatigue, and also major digestive problems. So she was searching, looking for some alternative, and she saw our website and knows that we have some alternative things going on here with Dr. Powell as well, with the bioidentical hormone treatments that we do. So she called us, and we sat down and had a consultation, and it looked like she filled out the form, and we did some preliminary labs. So she's given us permission, and this is what we're going to do. We're going to document her case, so people can see how this works and see if it might be something that would be beneficial to you or somebody that you know that's having trouble. This functional medicine approach is something that attracts people who have had kind of odd or really unusual or things that have not really been explained very well from a traditional medical point of view, and there's not really much that they have to offer. I'm not saying, I don't want to get into the medical, traditional medical is bad, alternative medical, approach is the way to go. Everyone needs a little bit of each. I'm a chiropractor and I work with a medical doctor. I believe that each type of approach is necessary and helpful, but not one thing can help everything. So there is a niche and there's a need for different things, or there is a need in a niche for alternative health care as well as traditional drug surgery care. So we're combining as much as we can to help people from both ends of the spectrum. So anyway, she is coming in and having our work done with the labs and the symptom survey, and trying to see how we can help her not cure Ehlers-Danlos syndrome. I just want to merely make sure that it's emphasized that we're not treating diseases. We're not trying to cure her of that. There is no cure for that particular syndrome. But she has fatigue. She has really bad digestion. She can't sleep at night. So these are things that we can hopefully help her with. Already, her digestion, just from the simple few things that we talked about and had her do, within 2 weeks, her digestion is so much better. So anyway, if you're interested in this kind of thing, let me know. You can email me.
Leave it in the comments.
Leave it in the comments. Let me know if this is something that you'd be interested in. Because if there's no interest, then we won't do it. But I'm planning on every Wednesday, not tomorrow, but next Wednesday. Every Wednesday, starting next week, we will be having some topic on functional medicine and documenting Cassie's. How she's doing, her her treatment. Not really treatment, it's just how she's doing with the care that we're providing, how she's responding and what we're doing and how we're doing it. And we will have her she was willing to we do have a video of her explaining what her situation is. So we'll do that next week, I think. See if we can get her here and have her explain her situation and how it's been going. So I think that's pretty much all I have to do for today. I just wanted to get you introduced to the idea and let you know that we're just going to do this starting next Wednesday at 12:15, Facebook Live. And just tell your friends, or if you just come on in and on Facebook and text me, or what did you say?
Comment.
You can comment. You see, I'm not very savvy with all this stuff. So this is new, but we're going to do it, and if there's interest, so just comment, text. You can call here at the office too if you're interested in finding out personally for yourself if there's something that you want to do. Basically, what I'm going to be doing is having a 15-minute free consultation if someone is interested, to see if I really think that it's a good match, if there's something I can actually maybe help you with or not, and then we can proceed from that point on, explaining the protocol that we're going to do, and go one step at a time. So thanks for stopping by, and we'll look forward to seeing you next Tuesday. We probably have, what do we have, Kiki, next Tuesday? Anything?
Are we going to do next Wednesday or Tuesday?
Well, I mean for Dr. Powell.
Fun with Botox.
We're going to do fun with Botox next Tuesday. And next Wednesday, we'll be doing fun with functional medicine. Thanks for stopping by. Have a great day.